I was chief of cardiac surgery at Memorial Hospital for 7 to 7.5 years. Essentially, I saw that there was a huge number of patients that had been previously either not referred or refusing treatment for superficial venous disease because there was really not a very good treatment for them. The treatment was so invasive, required so much downtime that patients just didn't have it done. In what I saw happening in cardiac surgery, where minimally invasive techniques were what the patients wanted, and where I saw its impact upon cardiovascular surgery in a negative manner, I could see that in the treatment of superficial venous disease, these newer techniques were going to have a tremendously positive effect. So I left cardiac surgery 2.5 years ago. I felt that in order for me to do this work well, it was going to be impossible to do it as a part-time commitment. And I had some thoughts about potentially continuing to do lung surgery or doing hearts 1 day a week, and I just never felt that I would do it well. So I just cut the cord completely. Started the Albert Vein Institute 2.5 years ago. We started in a small center of about 1,500 to 2,000 square feet, and within 3 months we were doing 40 cases a month out of one small operating room. And then we moved into this facility, which is 7,000 square feet. Has 2 operating rooms, 2 sclerotherapy rooms, full ultrasound facility. And basically what I wanted to create was an environment where patients could get all of their treatment, from their diagnosis, any medical treatment, and including their cosmetic services, all in the same place. And we could actually combine their follow-up appointments from their endovenous laser procedure with their subsequent cosmetic work. So when we have patients that come back for their 1-month follow-up, if they need to have ultrasound-guided injections of perforators or distal segments, we do that on the same day we do their cosmetic, and therefore they can kind of combine their stocking requirement, which is 7 to 10 days afterwards. We've tried to create here an extremely comfortable environment, which is very different than many physicians' offices that tend to be worn down and dirty. This facility is extremely clean, extremely modern, and all the equipment is state-of-the-art. The second is the staff that we've assembled, I think is really one of a kind. Everybody that comes in here for treatment says you have the best staff of any doctor's office that I've been to. And I think that is extremely, extremely important. That includes from the medical assistants, the receptionist behind the front desk, the office manager, and both our RN and physician assistants who do our sclerotherapy. So patients come, we offer them a complimentary consultation upon their first visit to give patients an opportunity. If they don't want to do any therapy, they can just walk away, and they had no financial responsibilities at all. In general, the majority, if not 99% of the patients who come, agree to proceed with a diagnostic ultrasound. We do that on site right here, and we have 2 RVT technologists who work for us. They perform the ultrasound, and then I see the patients either in the same day or at another time to go over their ultrasound, talk to them about whether they fall into the medical or cosmetic arm of what we do here, and then at that point we talk about treatment plans. We have multiple levels of assistance who can help them with their insurance, and also financing of their cosmetic work if that is needed. We perform between 4 and 5 endovenous laser ablations every day. We use the Cool Touch 1320 nanometer system, which we believe has the lowest incidence of bruising and discomfort. We do use conscious sedation during the procedures, and we think that's extremely important. The patient's tumescent anesthesia is not the most comfortable thing. Once the patients have their local anesthesia, they don't feel anything, but the process of that going in I don't think is very comfortable. So although we offer the patients the options to have or to not have conscious sedation, essentially almost all of them would rather have it. The procedures take about an hour and 15 minutes, and most of the patients are back to work the next day. We have an extremely competent staff to start with, and also my experience where I know a lot about the saphenous vein. I took it out of about 3,000 patients before I stopped doing heart surgery. So one of the common questions that patients have is, well, how can you take this vein out of me? Don't I need it? Well, I know that a significant number of patients who came to me for heart surgery, we would take their vein out. We would blow it up with saline to see what is this going to look like when it's exposed to arterial pressure, and it would blow up about 4 times normal size. Those are patients that we knew we could not use their vein for a conduit because it was just, the connective tissue was destroyed, it was too big and it just wouldn't work. So I think that having had the experience of taking the saphenous vein out of patients where it was normal and that they were able to do just fine without it, plus explaining to patients that if their saphenous vein is abnormal, that it could never be used for any type of future either cardiac or peripheral vascular bypass, gives them a level of comfort because it's a very, very common question that patients have. Thank you for visiting us at bestveincare.com. If there's any additional information that you need, please do not hesitate to call us or use the link